Going live. Hey guys, it is 8:30 p.m. It is Wednesday night. This is the first Wednesday lesson of the day of 2023. And to stay consistent, I'm doing this at the end of seeing 1,000 patients while I am a fair bit tired and will likely be hallucinating for part of this Wednesday lesson of the day. We had two things pop up that people wanted to go over today. One of them, interestingly, was damage from wand-based radiofrequency treatments. And the other one was people trying to decide between the type of lift, meaning they came in asking about, can I get an internal neck lift or a weekend lift versus a mini lift versus the aura lift, which is a deep plane face and neck lift. And you're the best. Come to Dallas soon. Anna, I'll be coming to Dallas soon. So the first one, which is heat-based or heat-based treatments, wand-based radiofrequency. These are probes that you place under the skin. They're called bipolar. They're not truly bipolar, but they're in the bipolar realm. And what it is it's a wand that you put under the skin in order to melt fat and get some tightening of skin. The devices that we have, there's various ones. They try to make people look like Matt Altman. I'm not sure if everybody knows Matt Altman. He's very good looking and famous, and people want to look like that. So that's why they use this device. So there is FaceTite, there is Thermi, there is Accutite, which is like FaceTite. There is J-Plasma, which is now called Renuvion. There's all these different ones. The idea for these is to melt fat and cause some kind of heat contracture, as well as form more collagen or something like that under the skin. Realistically, it's like performing liposuction with heat and melting some fat, then pissing off the skin. That's really what it's doing. So the risk of that in the face is that you're going to melt the face. And it's a bit counterintuitive to me that everybody is so focused on volumization of the face. The same person, Dr. A, will tell you to volumize your face and add fillers and maybe do some fat grafting, and then go tell you to do FaceTite and melt your face. So that doesn't make too much sense to me. It's a little counterintuitive. So I advise not using it in the face. But you can use it in the jawline and neck. And then you won't look like this. So you can do it in the jawline and neck and tighten up the jawline and neck quite a bit with doing these radiofrequency treatments. And those are all good devices for the jawline and neck. The risk, however, of doing this versus doing soft wave or Morpheus or profound, which are more diffuse treatments, not a wand-based treatment, is that you can get excessive atrophy or melting of fat, which would change the color of the skin because it changes the tone of the skin, might show more banding of the muscles in the neck. You could also get heat contracture, so you'd get exaggerated contracture of the muscles in the neck, and it gets worse. Very commonly with this or liposuction, you would get too much fat removal in the middle, nothing on the sides because the glands are there, and you end up with what we call a shotgun deformity or a cobra neck deformity. And you can get other issues like eschar, meaning you can actually burn through the skin and ulcerate it and have that happen. Now, in the best of hands, the chance of that stuff happening is very, very low. So if you go to a really good doctor, I wouldn't worry about that stuff. Just realize that it's a risk. And this is why you don't want to go for the gold when you're going for radiofrequency treatments or CO2 laser or any kind of heat-based therapy. You want to go for optimum. Optimum means don't go for the gold. Don't try to do the most damage possible to get a bigger improvement. The two don't correlate. So it is a misconception in surgery and a misconception in skin treatments that doing Mo is Mo better. I've said it before, Mo is not Mo better. Doing more damage does not inherently cause more improvement. That is not realistic. There is an optimum point at which you can damage and denature, but still allow your body to recover from. We call that the sweet spot for all these radiofrequencies and lasers. And when you do the treatments like that, maybe you don't get the biggest improvement possible on every single case, but you get pretty good improvements on every single case. And your complication rate goes to very low to nothing. So What do you do if this happens to you? What do you do if you get over melting of fat in an area, which I treated a patient yesterday for, or you get eschar or ulceration or contracture? The real answer to this is that you can never fully fix it. Can you suck my holiday wine out with lipo and laser, Danny Beniamini? Most likely, but we have to go in through holes you might not like to get it out. Back to the radio frequency. So if you get the heat contracture and you get severe platysmal banding, and I've dealt with a couple of patients like this, I tell them I cannot fully fix you because you are going to be missing fat under the skin, which means you'll always see the platysmal bands, and the platysmal bands on you will always be exaggerated because you can't completely denervate them, you can't completely cut them out, and if you're not completely doing it, you're always going to have some kind of platysmal contracture under there. So I tell them I'm going to get you a 70 to 90% improvement, something like that, which is pretty substantial, but you'll always have the remaining 10. Now, if you ulcerate the skin or you cause ischemia in the skin, which could happen with a facelift as well, those are things you can't really fully fix, unfortunately. So you just try to make them better by doing nanofat, by doing PRP, by doing little bits of lasers, by sometimes doing skin pigmentation, because if you have to form new skin, there's not going to be much pigment in there. It's going to be pseudo-epithelialization, which means you grow over epidermis with no real dermis, and there's no real pigment in those cases for most patients with larger ulcerations. That's that. So it doesn't mean don't do these treatments. It just means go to a good doctor so those risky things don't happen to you. And if they do happen to you, realize that you can't ever fully fix it. So don't chase it forever. Go to somebody who's good and can give you good advice. The other thing that people asked today was about lifting and saying, I want a mini lift. What's a mini lift? I've talked about this before, but if you're not researching my old videos because you find the old me boring, totally fine, because I didn't have as much hair back then. These hair transplants grew in maybe like a couple of years ago, so it's not so nice to look at, unfortunately. But if you were wondering what's the difference between a mini lift and a regular lift, in general, nothing. It is not really important to look at the name of the lift. It's important to look at the results of the lift. So you look at the results from Dr. A, B, and C, and you look at which ones look better and natural 100 patients in a row, not like looking at 2 patients or something like that. You can have a mini lift with tiny little incisions and get huge scars because there's a lot of tension on those little incisions sometimes. You can get a huge lift and get huge scars. Or you can get a huge lift and have no scars. So you have to really look at the results of the surgeon. The joke that we would make in our training was mini facelift equals mini result and maximum scar. So don't forget that. The same goes with lip lifts, mini lip lift, mini result, maximum scar. Typically, you're better off doing a full release or an endoscopic style lift when you're in those that realm of doing less and not making incisions and doing some bullshit little tiny thing that's going to put a lot of tension and give you no improvement. You wasted your money, you got a scar, you wasted your healing time, and it's very hard to revise those things. So mini lifts in general, when you hear that, they don't always make sense. Sometimes there is a mini version of a lift where somebody says, you know what, I'm going to do just the neck part on you or just this part, that part. That is a mini lift, and they might do an excellent job at it, which leads into me complimenting myself. I have a surgery called the weekend lift, which is, a lot of people call it theirs weekend lift. That's why it's not like trademarked or anything. Aura lift is and Cupid lift is, but not weekend lift. So weekend lift, I called it that because I learned it from the guy who trained me, and we used it for doing liposuction and chin implant, and then I changed it around and found a better way to do it, which I call an internal neck lift or an internal deep plane lift, which means I make an incision under the chin, go in, do whatever submental contouring I need to do, which means gland reduction, muscle reduction, lymphatic or fatty reduction, and do a platysmoplasty, and then go laterally from here, come grab the platysma, release it in a deep plane, and lift it up in the mastoid crevasse. I combine this with profound radiofrequency. Every once in a while I do a chin implant. Every once in a while I do neck liposuction. Pretty uncommon, very uncommon that I would do that. But the weekend lift gives outstanding results. For me, that weekend lift is kind of a mini lift, but it's only really treating the neck while the profound treats the face. The advice I have is don't listen to the name of any of these procedures. I call it weekend, this guy calls it weekend. I call it weekday, that guy calls it weekday. It doesn't matter what it's called. You look at the results, Look at the practical downtime. If you trust the doctor, then listen to what they say about the downtime and believe it. Don't doubt it. And you do what makes sense for you, but don't for a second think that smaller incisions necessarily mean less scars because they're smaller incisions or it's a mini. That is not true, never has been true, never will be true. You can even have an endoscopic type facelift by a surgeon who's not so good, and it causes an untoward tension. You can end up getting a pixie ear or rotation of the ear in those cases. So even in endoscopic lifts, things can go wrong if someone pulled too much in one direction or another, which is why you just look for the best people and see who gets consistent results with any kind of technique. And I tell my patients all the time, I could cut you straight across the face and stitch it up, you won't see that scar. So don't worry so much about scars with me unless you're a true keloid former, then we'll talk about it. Otherwise, it doesn't matter where the incisions, or if you have incisions or not, they tend to disappear. They just sometimes require more treatment. And that's it. 8:39 p.m. Not too bad. I'm getting out of here. Tamara Elkin, scars fade, but not emotional ones. No, those fade too. Okay, I'm reading, for people who watch this later, reading the messages over here. And is there a mini lift for the bottom of my face? Yes. Will radio frequency help in dissolving the filler, reducing the volume? Interesting question. Radio frequency will decrease your overall volume. It can also cause an inflammatory response in the face, which metabolizes filler faster. It can also cause a mild denaturation of filler, so some of it might go away faster, but it does not fully melt filler. Just so you're aware, it's a gel that doesn't melt, but you can denature the collagen cross-link, or the hyaluronic acid cross-linking a little bit with the high heat if it's nearby. And am I coming to Virginia? No plans for Virginia. My license might still be suspended there, so can't drive through Virginia. All right, I hope everybody has a wonderful night, and I will post this in case it helps anybody.